Hi, I'm Dr. Goh Kim Yen from Ampang Putri Specialist Hospital. I'm a general physician and I specialize in hematology as well. Cholesterol is a type of fat that actually exists in our blood. So if you have too much of fat in your blood, you have a condition which is called hypercholesterolemia, which means too much of fat in your blood. There are two broad types of cholesterol. They're called HDL, which stands for high density lipoprotein, and there's one type which is called LDL, which is the low density lipoprotein. So in a general layman term, HDL, or the high density lipoprotein, is a good protein. It protects you against blockage of blood vessels, whereas LDL, or low density lipoprotein, is a bad cholesterol. This type of cholesterol blocks blood vessels. There are two broad reasons why a person can have a high cholesterol. Of course, the genetic part plays a role. So certain high cholesterol level runs in family. So it is in the gene of that person that results in high cholesterol. Of course, the diet plays a role as well. So people who engage themselves in high-fat diet, who lacks exercise, or who are obese, so these people could have a condition what we call a high cholesterolemia. A lot of times there's no symptoms related to high cholesterol. So if you have a strong family history and you fall into an age group, especially beyond 50 years of age, I would advise you to go for a blood test to test if you have a condition what we call a high cholesterol level. And people who have diabetes or underlying blood disease, I would strongly encourage you to screen for high cholesterol. So the test for cholesterol is actually quite simple. What we need to do is to ask you for a 10-hour fast. For example, if you're going to come to the doctor at 8 o'clock in the morning, I would advise you to start fasting from 10 the previous night and come empty stomach. You have a blood test, then you go for your breakfast, and you come back an hour later, we can give you the cholesterol results. There are a few factors that one should watch out for to prevent or to treat a high cholesterol condition. For example, if one is overweight, I would advise the person to actually go on a weight-reducing diet. Of course, from the diet part, the person should actually watch out for and to avoid a high-fat diet, especially diet that is actually with a high content of trans fatty acids. And at the same time, if you have an underlying medical problems, for example diabetes or high blood pressure, you should as well come forward to be screened for a high cholesterol condition. And the other reason is lack of exercise. So if you think that you are prone to have a high cholesterol condition, you have a strong family history, I would advise you to go for a lifestyle changes. These lifestyle changes include like cessation of smoking, regular exercise, as well as watch out for your diet. So how do we treat a high cholesterol condition? Of course, there are two main broad categories of treatment. One is the non-drug treatment. For example, lifestyle modification. Watch out the diet. You have to reduce the risk of a coronary artery disease. For example, you look after your diabetes, you take out the blood pressure, you go for regular visits to your doctor to make sure your diabetes and the high blood pressure are well looked after. And if all these fail, then your doctor may advise you to go on tablets. And nowadays, there are many types of tablets which you can take to control your high cholesterol condition. And one of the groups is the statin groups. And it is well proven and it's been tested for many years. So why is cholesterol so bad for a person? Cholesterol results in sticky plaques along your blood vessels wall. So if these plaques happen in the coronaries or the blood vessels in your heart, this may cause blockage of the heart. If these plaques land in your blood vessels in the brain, this would result in a stroke. So it is very, very important to make sure that the cholesterol level isn't too high.